Hi, I am Dr. Deepak in Inamdar. I am a senior consultant orthopedic and robotic joint replacement surgeon. Does a robot do the entire surgery? No. Right now we are having the first or second generation of robots which are surgeon operated. The planning is entirely by the surgeon. That means the brain is the surgeon's brain. The robotic arm executes what the surgeon plans. So it is basically the surgeon using technology, GPS, computer, the trackers and a robotic arm to get in the desired alignment and balance for a particular knee. Coming to the myth whether only the elderly get the robotic knee replacement, no. Age is not a criteria. The youngest patient I have done knee replacement is a 27-year-old who had severe knee arthritis. So it depends on the severity of the knee arthritis. If the knee arthritis is extremely severe, age is not a criteria, and robotics makes it even more appealing as a tool for the younger patients because you get excellent alignment, which is important for longevity of your implant. So it can be done at any age group if your knee arthritis is severe and disabling for you. Success rate of knee replacement surgery is extremely good. 90 to 92% of the patients are extremely happy with the surgery. A fit patient having the right frame of mind will do very well. A positive patient will do very well with the surgery. So it's an excellent surgery if you come in with the intention of getting better. So I tell all my patients that if you have that positivity inside, that you are going to do well after the surgery, you will do excellent with this surgery. Irrespective of one doing a robotic or non-robotic surgery, one does require physical therapy because first you require first 3 weeks of rehabilitation to strengthen the muscles. When we have made an incision, the knee becomes weaker. So to strengthen those muscles, you require physical therapy. The second aspect of physical therapy, what you require is to get good range of movements. There are some patients who come in with bad deformities and restricted range of movements. In such patients, you require physical therapy to get back your range as much as possible. The third aspect of physiotherapy is to reduce your pain and help in healing. So if one takes regular ice packs, an ice pack every 20 minutes, every hour one should need to take 20 minutes of ice packs. So if one continues this for a period of 6 weeks to 3 months, the recovery is fantastic. So physical therapy is an integral part of knee replacement surgery. It can last from a period of 3 to 6 weeks depending on how fit the patient is. So irrespective of whether you are undergoing robotic or non-robotic, you will require physiotherapy. So the range of movement what the patient gets ultimately depends on how much range he has before the surgery. A patient who has good range before surgery will get good range after the surgery. If the patient has got a restricted range of movements before surgery, one can aim to get the same range after the surgery. So this is the important criteria as to how much range you are going to get after the surgery. If there are some issues which develop with the surgery, like 1% can develop infection, or if there are some other issues which develop with the surgery, we always have measures or means wherein it can be rectified. So one need not hesitate if the surgery has failed. Please approach your doctor. He will do the best for you. Coming to the myth that knee replacement implant does not last more than 10 years. The current implants, the current technology available makes most of the implant last more than 15 to 20 years. So one need not hesitate or fear for undergoing knee replacement surgery. Let me explain as to how to schedule your knee replacement surgery. If you are planning to get it done, what are the steps one needs to take? Please schedule a consultation after which we can fix a date for your surgery. The second thing what you need to do is process your insurance documents maybe 1 week before. There are a list of attachments for the insurance. So you have to process your insurance. One needs to get admitted 1 day before the surgery, 1 day before the scheduled date. For both knee replacements, you require 7 or 8 days of hospitalization. For a single knee, it's 4 or 5 days of hospitalization. For both the knees, I give a gap of 1 day. I do one knee, give 1 day gap, and then the second knee, after which the physiotherapy starts. One needs to stay for a period of 2 days for a bilateral knee replacement in the ICU. So it is for the patient safety which we keep the patients in the ICU. After discharge, you can come for a follow-up 2 times every week. If there is a stitch removal which needs to be done, we can do it at the same time, 16 to 18 days. The advantage of using the skin glue for a robotic knee replacement is that it's painless to remove the stitches. It's waterproof. One can take bath on going home. So these are the protocol, or these are the measures one needs to do before scheduling and getting the surgery done. So this is how it's done for knee replacement surgery.